Number 61. A client with a developmental disability has requested that she would like to attend a sex education class. The parents are wondering if this is appropriate. What would be the best approach to take? The answer is, if a client with a developmental disability requested that she would like to attend a sex education class, and the parents wondered if it was appropriate, the answer is, sex education is within the client's right to choose to engage in. Everyone should be allowed to learn more about their sexuality and body. Sex education is within the client's right to choose to engage in. Number 62. The psych tech has been assigned to develop a program to discuss sexuality of clients with developmental disabilities. What should clients be taught about sex and privacy? The answer is, if the psych tech has been assigned to develop a program to discuss sexuality of clients with developmental disabilities, what the clients should be taught about sex and privacy is, to have meaningful and consensual relationships with preferred partners. Number 63. What are some important facts to emphasize when teaching clients with developmental disabilities to understand sexual behavior? The answer is, some important facts to emphasize when teaching clients with developmental disabilities to understand sexual behavior are, you have the right to say no at any time. Number 64. After knocking on the bedroom door of an adolescent client with a developmental disability, the psychiatric technician enters and observes the client masturbating. What action should be taken by the psychiatric technician? The answer is, the action that should be taken by the psychiatric technician is to apologize and close the door. Number 65. A group leader walks into the group room and observes a client masturbating. What is the best response to make? The answer is, if a group leader walks into the group room and observes a client masturbating, the best response to make is, tell them it is inappropriate in public spaces and redirect to the bedroom or bathroom. Teach privacy. Number 66. What action should the psychiatric technician take upon observing a client with a developmental disability touch his genitals in the dining room? The answer is, the action the psych tech should take upon observing a client with a developmental disability touching his genitals in the dining room is, ask if they need to go to the restroom and redirect to somewhere private like their bathroom or bedroom, and encourage hand washing after behavior management. Number 67. At Canyon Springs, Bertha resists waking up in the morning. The group leader wants to increase the behavior of waking up with the alarm clock. Using the technique of shaping, what should the psych tech do? The answer is, by using the technique of shaping, the psych tech should give the client a token as a reinforcer for smaller accomplishments. The smaller accomplishments would be not hitting snooze, or lying awake in bed. Then reinforce bigger changes towards the target goal. An example would be sitting up in bed, and getting out of bed. Number 68. The psychiatric technician has been requiring David to sit in the corner for 5 minutes whenever he hits one of his peers in his group. What procedure is the PT using? The answer is, the psychiatric technician requiring David to sit in the corner for 5 minutes whenever he hits one of his peers in his group is the timeout, withdrawing reinforcer. This is a negative reinforcement. Number 69. There has been no decrease in David's hitting during the 2 weeks that the PT has been sending him to the corner following his hitting. What has the PT learned about sending David to the corner? The answer is, if there has been no decrease in David's behavior by hitting during the 2 weeks that the PT has been sending him to the corner, the psych tech should learn that by sending David to the corner, may be reinforcing and it is not punishing. Number 70. As David is being escorted to a chair in a corner of the group room for hitting his peers, he bites the arm of the psychiatric technician. What behavior is David displaying? The answer is, the behavior David is displaying by hitting his peers and biting the arm of a psych tech is elicited aggression. Question 71. A psychiatric technician has recently been assigned to work with a client that has been labeled as aggressive. What is the first step that the psych tech should take? The answer is, if a client is labeled as aggressive, the first step that the psych tech should take is collect baseline data including the frequency and triggers of aggressive behavior. Question 72. The psych tech determines that the client receives a great deal of attention for the aggressive behavior. What is the best action for the psych tech to take? The answer is, the best action for the psych tech to take is, give attention and praise only when the client behaves appropriately. Use extinction for inappropriate behavior. Question 73. A severely retarded client named Susie becomes quite agitated in the group room and starts to hit, kick, spit, and bite 2 clients who are in her immediate area. What should the psychiatric technician do? The answer is, the psych tech should remove Susie immediately to the timeout area, find triggers, document the number of times it happens, and ask her to apologize to the clients. Question 74. A client with a developmental disability becomes agitated while sitting in the group room and throws a magazine across the room. According to the normalization principle, what approach would be best for the sci-tech to take? The answer is, according to the normalization principle, the best approach for the sci-tech to take is overcorrection or restitution. He should make the client pick up the magazine and other objects on the floor. Question 75. Mauro throws the milk carton onto the floor during lunch, spilling the contents. The group leader decides to use overcorrection to change this behavior. What should the group leader require Mauro to do? The answer is, the group leader should overcorrect this by requiring Mauro to wipe up all the milk she spilled and mop the entire floor. Question 76. Raymond throws a box of blocks across the room. The group leader decides to use overcorrection to change this behavior. What should the group leader require Raymond to do? The answer is, to use overcorrection to change this behavior. The group leader should require Raymond to pick up the blocks and clean the rest of the room. Number 77. The group leader wants to decrease out-of-seat behavior in a client. Which approach is best to take? The answer is, to decrease out-of-seat behavior in a client, the best approach to take is to reinforce the student when they are in their seat. Number 78. The group leader has decided to implement an extinction procedure by ignoring Janice's annoying behavior of whining that she exhibits frequently. What will the group leader expect to occur upon implementing the extinction procedure? The answer is, what the group leader should expect to occur upon implementing the extinction procedure is, it will increase significantly at first before it decreases. Question 79. Stephen urinates onto the floor of his room every night. The staff decides during the interdisciplinary team meeting on a plan to put an end to nocturnal urination. Which approach would be best to take? The answer is, to stop him from peeing on the floors. The interdisciplinary team meeting should make him clean up the mess and himself, limit fluid intake before bedtime, wake him up to use the bathroom during the night, and teach him to communicate needs.